This one was on blood biomarkers. So obviously blood biomarkers are becoming more and more interesting as, time goes on, looking for some sort of definitive way to diagnose concussions. It's been very hit or miss, very spotty. This was the NCAA and Department of Defense CARE Consortium. So they've been pumping out a ton of research over the past few years. And this one was looking at 103 military recruits and 67 cadets that incurred concussions during combative training. So they were doing like hand-to-hand combat, and some of them got concussions and others didn't, but they were still kind of included in that subconcussive type of group. Anyway, they made the conclusion that blood biomarkers were actually able to accurately distinguish between these two groups of who was concussed and who wasn't, with as much as 80% accuracy. Now, when you actually look at the charts, and I'm going to show them on the next phase, you see that that's not really that simple. When you take a full group sample and compare one side versus the other, you can see kind of these differences. Overall, the mean is going to be different. But when you try to take this and look at it from an individual perspective, can we use a blood biomarker to inform our diagnosis? The answer is actually no. And I'll show you kind of how that works statistically on the next one. This is their typical thing. So this is the SCAT, right? So this is their SCAT symptom severity scores. This is their best scores. This is their another symptom inventory score, and this is the SAC, which is a standard assessment of concussion. The interesting thing is even at baseline, the concussion group was reporting higher symptoms. So prior to injury, they're reporting higher symptoms, a worse best score, higher symptoms on this symptom severity score too, and a worse SAC score. So something's going on here that they were actually worse from the get-go, which is strange. So here's the violin plots, and you can see here that this is looking at, so this is GFAP. These are just different biomarkers. So this is GFAP, this is UCHL1, this is neurofibrillary light, and this is tau. Now, if you look at the difference here, like GFAP, for example, if you look at the means, so this is baseline, right? They're pretty much dead on. And then here you see that the means separate, the means separate, the means separate, the means separate. So this was considered a significant difference, but you can see here the overlap in this, like the bulk of people in the concussed group are, around this area. The bulk of people in the other group and the non-concussed are around this area. So the bulk of people, it's going to be fine. But what happens if you get a patient who's basically right here, right? Are they concussed or not concussed? Right? It becomes very difficult to distinguish between one or the other just based on a single finding. So this is the difference between looking at something from a group as a whole. You can say that, if we look at everybody together, we can, see group differences. But if you were actually to try and do this at the patient level and you get a finding that's somewhere in the middle here, it's going to be inconclusive one way or another. Even if you got one way up here, they could be in each group because there's overlap, right? You can see these whisker plots here. There's overlap between these two groups. Unless you have clear separation, it becomes very difficult to make a distinguishing decision. And I'll show you in the saliva sample how that's a little bit different. Again, this is UCHL1. You can see this is at baseline. Then you can see there's separation between the means, but you see overlap between the groups, right? Overlap between the groups, overlap between the groups, overlap. So there's overlap on all of these, which makes it a little bit difficult. So here's what they said. These data suggest that GFAP and UCHL1 biomarkers have the potential for use in future studies of concussion in a combative training setting, with UCHL1 having a relatively early period of detection and GFAP having a longer lasting increase. As you can see, GFAP stays elevated longer, and UCHL1 is like boom, and then it kind of averages out. Overall, the receiver operating characteristics analysis indicated that the addition of blood biomarkers did not provide any greater discrimination between the two groups. So basically, what we have clinically was good enough to be able to distinguish them in the groups. Blood didn't even add anything to it. So the conclusions on the abstract versus the conclusions in the paper, and when you actually look at the data, are completely different things. And so that's something to pay attention to.